Hello, and thank you for joining me today. I will be discussing the psychopharmacological treatment for anxiety using the case of Adam, who is a 48-year-old male with chronic anxiety, as an example. In this presentation, I will explain the diagnosis, evaluate the treatment models, and recommend a psychotropic agent using current research. Adam is a 48-year-old man who has experienced anxiety for most of his life. He reports racing thoughts at night, sleep problems, and physical symptoms like difficulty breathing, tingling, and cold sweats. His worries about his financial future further exacerbate his condition. Based on Adam's symptoms, we diagnose him with generalized anxiety disorder. This disorder is characterized by excessive and uncontrollable worry, accompanied by various physical symptoms, and it tends to be chronic. There are two key treatment models for generalized anxiety disorder. The medical model focuses on the biological side, such as neurotransmitter imbalances, while the psychological model addresses how thought patterns and behaviors maintain anxiety. In practice, an integrated approach that uses both models is often most effective. Recent research strongly supports using SSRIs and SNRIs as first-line treatments for generalized anxiety disorder. Baldwin and Gardner of 2021 report that SSRIs boost serotonin availability and have achieved clinical response rates of 60 to 70% in generalized anxiety disorder patients, with SNRIs providing the added benefit of norepinephrine modulation. In addition, emergent studies by Turner and Emerton in 2022 suggest that low doses of CBD can effectively reduce anxiety by modulating serotonin receptor activity without causing the psychoactive effects associated with THC. Lastly, clinical guidance from Preston and Talaga in 2020 underscores the importance of starting with a low dose and gradually increasing it to manage side effects such as gastrointestinal discomfort and sexual dysfunction. This integrated approach ensures both efficacy and safety in treating generalized anxiety disorder. For Adam, I recommend initiating treatment with an SSRI such as escitalopram. This agent works by blocking the reuptake of serotonin, which increases its availability in the synapse and helps reduce anxiety symptoms. Baldwin and Gardner in 2021 support this choice by emphasizing its efficacy and safety profile. Escitalopram's ability to offer long-term symptom control makes it the preferred option, although SNRIs remain a viable alternative if additional neurotransmitter regulation is required. Escitalopram's primary action is to increase serotonin availability, which stabilizes mood and reduces anxiety. This pharmacological effect translates into fewer anxious thoughts and better sleep. Over time, the improved neurotransmitter balance can also help lower stress hormones like cortisol. Preston and Talaga highlight that effective psychopharmacological interventions not only correct neurotransmission but also contribute to overall hormonal balance. Based on current research, the potential effectiveness of escitalopram is high. Clinical trials reviewed by Baldwin and Gardner show that many patients with generalized anxiety disorder experience significant symptom improvement within several weeks. This medication is expected to enhance Adam's daily functioning, reduce his physical symptoms, and promote overall well-being. While escitalopram is effective, it does have limitations. There is often a delay of 2 to 4 weeks before therapeutic effects become noticeable. Additionally, side effects such as gastrointestinal issues, insomnia, and sexual dysfunction may occur. These factors necessitate regular follow-up appointments to adjust dosages and manage any adverse effects. Preston and Talaga stress that continuous monitoring is crucial to optimize treatment outcomes. To conclude, Adam's case of generalized anxiety disorder is clearly identified using the DSM-5 criteria, an integrated treatment approach combining SSRIs like escitalopram with psychotherapy is supported by current research. This method not only corrects neurotransmission but also addresses behavioral and hormonal aspects of anxiety. Thank you for your attention.